Okay, here's my next book, Prevent and Reverse Diabetes. We're doing the next part here. This is part 10 of Prevent and Reverse Diabetes. We were just finishing up talking about how a lot of these endocrine disrupting chemicals, they also increase your risk of diabetes. In particular for this study, BPA, bisphenol A, that's on all the plastic bottles, and phthalates, another form of plastic like a plastic conditioner to shape it. These plastics are super common. These are also in a lot of your bottled waters. Okay, so they increase your risk of type 2 diabetes and obesity. Not good. Estrogen in general is a fat storage hormone. Okay, that's page 94 of the book. And then here is about the nonstick cookware. The nonstick cookware gives off chemicals, PFOA, that is toxic to the pancreas beta cells. PFOA means perfluorooctanoic acid, widely used in lubricants and in nonstick cookware. And they found that it was destroying pancreas beta cells in rodents, meaning those are the cells that make insulin in your pancreas. Not good. So you don't ever want to cook on those things. You don't need to use that nonstick cookware. The only thing I cook, for my starch is I just boil everything. I would not use nonstick cookware. Okay, that's a good reason. Pancreas and aluminum, so you got to filter your water too. Okay, here's obstructive sleep apnea. Lots of fat people have obstructive sleep apnea. Lots of diabetics have obstructive sleep apnea. And if you want to talk about who are the stupidest patients, the stupidest patients typically, the dialysis patients are the worst. I feel sorry for them. They're really pretty screwed. They got poor blood flow, a lot of them, to their brains. Diabetics are notoriously kind of stupid. And then also the sleep apnea patients, on a common basis. I'll tell you, my internal medicine doctor buddies will tell me every single one of their patients over 60 is cognitively slow. It's uncommon to see a bright person after 60 years of age. I'm 61, by the way. If you keep the arteries to your brain open, you can get smarter as you get older because you got more knowledge. But if all your arteries are being plugged up, you're not going to do so well, okay? So sleep apnea, you're hypoxic at night. I've seen these patients through sleep studies, they're dropping their O2 sats into the 60s, okay? Not good. So that means you're depriving your brain cells of oxygen. And the same patients are often diabetic with a lot of insulin resistance, depriving their brain cells of glucose because of the insulin resistance. Not good. So, you want to lose the weight. And you know how to lose the weight. I told you, just do what skinny people do. Eat low-fat starches. It's not rocket science. No processed food. No oil. Nothing from an animal. Nothing. Zero. Nada. No half-ass BS, okay? You don't tell an alcoholic you can drink on the weekends. They don't drink anymore. No alcohol. Not one drop. You don't tell a smoker you can smoke on the weekends. You don't smoke anymore. Not one puff. Not one drop of alcohol. Okay, if you want to get better, that's what you do. And all these patients are so stupid. They give me this big sob story. Oh, I have to give up dairy or meat or ice cream or something. I'm like, look, pal, I don't care. You want to be a stupid moron. Go ahead, eat all your junk food and your crap, okay? I mean, most people have what I would consider very low standards. They say, I'm doing okay, and they mean I'm not as fat and sick as my cousin. And whereas I'm totally elitist. I want to be the best I can possibly be. I want to be the best doctor in the world. I think I already am. Okay, I want to compete with the best doctors, okay? And when they sell out and do something stupid, I'm like, okay, fine, you just dropped out of competition. Good for you, okay? I'm glad you got paid off, but you're no longer in the competition for being the best, all right? So anyways, that's the obstructive sleep apnea. You get the fat out of your body, you clear up your airway, you might get better. It might be a neuropathy in some patients too, but that hypoxia is not doing you any favors. You're losing brain cells. Okay, here's some parameters for diabetes. Normal hemoglobin A1C, that's a measure of how glycated is the hemoglobin in your red blood cells. And your red blood cells live about 120 days, so it's a measure over, which is 3 months, of over the last 3 months, how good your blood sugars have been. Fasting blood sugar should be less than 100. For pre-diabetics, you got a hemoglobin A1C over 5.5. Fasting blood sugar, 100 to 126. For frank diabetes, type 2 diabetes, you got a hemoglobin A1C over 6.5 or a fasting blood sugar over 126. Severe sleep apnea patients there, on the highway to becoming demented. We talked about the Jack Talatorre theory of the vascular hypotension, hypoperfusion theory of dementia. Basically, he tied off the carotid artery in a mouse, and then 2 months later, middle-aged and older mice would become demented. He looked at their brain. There was no stroke on the side he tied it off. There was just atrophic brain. So chronic lack of blood flow deprives the brain cells of oxygen and glucose, and they have a metabolic demand too high relative to the oxygen and glucose delivery. The brain cells just die. They go into apoptosis, programmed cell death. Programmed cell death means they die gradually and their contents, their chemical composition is recycled by the macrophages in the brain, the microglia. They eat it and then they send it to other brain cells. Okay, and that's what I mostly see when I see all these demented brain MRIs and brain CTs, CAT scans, is atrophic brains. I don't usually see a big stroke or a big tumor, hydrocephalus, any of that. I see atrophic brains. Okay, so the point is don't end up like them. Don't end up like the mouse. Don't let yourself become severely hypertensive. Don't overtreat your hypertension, okay? Don't develop intracranial atherosclerosis by keeping your dietary fat low. Don't become diabetic by keeping your dietary fat low and avoiding all these toxins I just talked about, like all these estrogenic chemicals as best you can, these nonstick cookware, aluminum in your drinking water, etc. And then I also have given separate lectures. I'll come back to it a little bit in this book. Avoid these mitochondria inhibitors because, it's really a trifecta. This is the Peter Rogers, MD, theory of neurodegeneration. There's three major things going on simultaneously. Number one, you got a metabolic rate in your brain cells. Number two, you got an oxygen and glucose delivery. They should normally be matched. I call it the supply and demand theory. They should normally be matched. That's also sometimes called neurovascular coupling. Okay, that oxygen and glucose delivery is coupled or matched to metabolic rate of the brain cell. All right? But there's a second thing. You activate a cell by increasing cytoplasm calcium. Then you have to pump out the calcium. Well, that means you have to use ATP to do that. Adenosine triphosphate, which is made by mitochondria. It's the energy of the cell. The $20 bill in the cell is the ATP. And what I'm saying is you have to have lots of ATP production capacity. But if you got all these mitochondrial inhibitors on board, like MSG, MSG is actually a stimulant. That's like an excitotoxin, including aspartame, including glyphosate, including beta amyloid protein. But then there's mitochondrial inhibitors. That's things like Tylenol, metformin, statins, atrazine, BPA. Okay, there's a lot of them. There's a lot more of them too. Fluoroquinolones, selective serotonin reuptake inhibitors, tricyclic antidepressants, antipsychotics. There's a lot of them. Propofol, general anesthetics. I could go on and on. Beta-lactam penicillins, aminoglycosides. All right, anyways, and heavy metals, mercury, lead, fluoride. All right, hydroxynonenal, the lipid peroxide, toxic aldehyde related to omega-6 cooking oils. All right, so they're all bad. Avoid all that stuff as much as you can. Okay, that's the mouse studies of Delatorre. He thinks that's actually why Ronald Reagan became demented, because when he had that terrible event where he had tremendous blood loss, his brain was hypotensive for a while, and then he became demented after that. Okay, and then there's other diseases that are similar: congestive heart failure, atrial fibrillation, aortic regurgitation, the valve disease, aortic stenosis. Okay. Let's see. Also, you just get atherosclerosis in your brain from being hypertensive and being diabetic, and you end up that being kind of like a mouse equivalent. You deprive your brain cells of adequate blood and glucose and oxygen supply. Okay, I think we'll stop right there for today. I hope you found it helpful.